Hello everyone, and welcome to the Health GoLIVE webinar series. Today's episode is brought to you by our friends at SailPoint. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Stay on after the webinar to prepare an incredible holiday dessert with Master Chef Matthew Migliori. And with that, I will throw it over to our moderator who joins us from Ernst & Young, Rajesh Padiyal.
Thanks so much. Hello, everyone. Welcome to a session which we are expecting to be very informative, relatable, and current. And before I get started with the details, I wanted to provide a quick introduction myself and the panelists. We have an exciting set of panelists today. And again, as mentioned at the beginning of the call, if you have any questions, please feel free to keep those coming. We'll be more than happy to address it as we go along. So about me, my name is Rajesh Padiyal. I'm part of the EY cybersecurity team. I've been supporting the health sector, health and life sciences sector for the last 10 years, but I've spent some time in different sectors like automotive, telecom before that, predominantly focusing on the identity and access management space. And as they mentioned, I'll be the moderator today, but we have a good set of panelists. Let me get started with the first one. Kimberly, if you want to go first with a quick introduction, that'd be great.
You bet. Hi there, I'm Kimberly Carasino and I'm at Providence Health and I'm the Executive Director over Identity. My focus is on strategy, vision, and our customer experience.
Welcome, Kimberly. Mike, you want to go next?
Sure. I'm Mike Ratliff. I run network defense for Providence. My primary responsibilities are threat intelligence, CERT, pen testing, and anything dealing with software and cloud security.
Welcome. Matt.
Hi, everybody. My name is Matthew Ratliff. I'm the Area Vice President for the Healthcare Business at SailPoint. Have spent the better part of the last 25 years in identity and security with a specific focus on healthcare. So nice speaking with everyone today.
Welcome, Matt. Looking forward to the conversation. But before I actually get started with the key set of areas or topics of discussion, what I wanted to highlight is it's interesting how the COVID pandemic has created a clear delineation between before and after, right? All strategies, be it your digital transformation strategy, your cyber strategy, or strategy related to your enterprise, is now very clearly marked as, hey, what was our strategy before, but there's a marked shift on what it needs to be after. And keeping around that same theme, what we wanted to do was talk about a few topics that as I said before, would be very relevant and relatable in a provider space. But also, if there are topics that we feel or you feel that we've missed, please feel free to bring those up as part of the Q&A. So to get things started, why don't I start with you, Kimberly, on just defining how has the organization managed a dynamic set of complex user identities within your identity strategy, also from your overall organization perspective, and how has that changed over time? And also, before we get there, maybe Matt, if you can spend a quick minute to talk about how do you define complex user populations, and then maybe we'll go over to Kimberly to define how Providence has done it on their side.
Yeah, that's great. Thank you, Rajesh. So look, when we talk about an identity, we first want to think about really the DNA of what an identity is. And first and foremost, at the highest level, it's first of all, is it a human being? Is it maybe a robotic automation process? Is it an IoT device, right? So the first part of understanding that DNA is what kind of identity are we dealing with? And then we want to get very organic with that identity once we understand what it is, right? And a lot of times that has to do with the relationship with the organization. So if you think about healthcare and a human identity, that relationship could be a full-time hospitalist or employed physician, a full-time nurse, or maybe even a contract nurse, student, researchers. And the challenge that a lot of health systems have is these relationships can be very dynamic. You can have someone that actually sits in one-to-many of these different type of relationships, serving one-to-many different roles. And over their life of their relationship with the health system, you know, those roles can change. They can transfer from one identity type to another. They can have multiple roles across multiple different identity types. And that becomes a bit of a challenge for the organization to handle. And really, you know, if you think about how do we stitch together what we call the attributes that define who this is, what role do they serve, who do they report to, It's all these little attributes that we have to stitch together to define how we're going to manage that identity. One of the last challenges that health systems have is that these different identity populations come into the organization through what we call different authoritative feeds. HR systems being the probably the most common, but physician credentialing systems can serve as authoritative feeds. It's not uncommon for academic teaching facilities to have multiple relationships with universities, and those med or nursing students also come in through different feeds. Could even be a flat file fee, but a lot of times they have either a contractor portal or a non-employee portal. So the organization, and Kimberly is going to talk about how they do this at Providence, they're dealing with all these complex and dynamic user populations on a daily basis and trying to figure out how to most effectively manage them and enable them with the access they need to provide clinical care. So Kimberly, I'll let you take it from there.
Great, thank you. And yeah, everything you're talking about is absolutely, the complexity is amazing. So at Providence, we embarked on a journey starting about 4 years ago now, with the intention. We grew through acquisition, so we had many disparate systems that were managing identities. And so the goal and the strategy was to get to one system, and also to get to a set of processes that worked for our non-employee populations, like you referenced there. And so everybody's onboarded the same way, with the same attributes, with the same level of information. Another goal was to require everybody to have the same unique identifiers. So we require last four of social and full date of birth for everybody, non-employee and employee alike. And so we have all the same information at the identity layer. And then we customized our system so that we track everybody's role, if you will, or their purpose of having access to our systems as a persona attached to that identity. And so we have, like some of our telehealth docs, we have as many as 27 personas for them based on their credentialing. And so that enables us to discreetly and distinctly manage their access based on their roles. It is helpful. It is, we're still on the journey. We have some legacy data to clean up, but we're almost there. During COVID, one of the things that it was really helpful to have this attribute-based mapping for these personas so that we could provision and enable some more automation based on the user's attributes. The one thing we don't have in place that we need to get in place is the ability for us to bulk upload a lot of new hires quickly. There's a couple of use cases like strikes and COVID that have really shined a light that by not having that, there's a lot of spreadsheets and manual building processes that need to happen.
Yeah, thanks for that, Kimberly. I agree, based on my experiences and what I'm seeing in the industry in general, is the ability to manage and have the flexibility to go in and account for the changing environment as well. Now, along the same theme, you kind of touched upon that, but I wanted to see if we can dive a little deeper on what has the strategy been, or how has it been different since COVID, your overall strategy? Because as I said before, there's been a pre and post COVID strategy. So just curious to hear your thoughts on how Providence has handled it and how has it been different since COVID has started?
I think actually our strategy worked pretty well for COVID. I think the things that not having the bulk capability was one area we need to explore, but it really accelerated our automation. So we have the capability before COVID to include ePHI in our automated builds for new hires. We've had it for a couple of populations, but between the first in March and between then and now, we've accelerated that automation. So now for all of the nursing population, new hires, of which we're onboarding, a lot, are getting their appropriate ePHI access through automation. And so that is enabling us to get people onboarded more quickly and to not add extra burden on our operations team that we're manually doing the builds. So I think we feel pretty good that our strategy was really helpful. We're glad that we were as far down the road as we are. So that's been really a positive thing. Having that identity persona model was extremely useful because we had a lot of nurses that were, as our clinics were closing because there were, weren't having appointments, we were able to redeploy those nurses to the hospitals and other clinical staff to the hospitals and track that move in SailPoint. Because
Right, and I
eventually
think
they're
this
going to
is
go
a
back and we need to unwind it, right? So we need to be able to
absolutely, and I think this is a
remove the
true
access.
use case and a representation of how cyber has now come to the forefront, especially from an identity standpoint of meeting organizational needs, right? So it's like being nimble and flexible to do that. Now, if we can quickly switch over, because I think historically identity and cyber have been intertwined, but not so much as much as we would have liked it, but COVID has pretty much transformed that, right? So Mike, if you don't mind touching upon the topic of how you're protecting identities both inside and outside of the four walls of the organization at Providence, right? So that might be useful.
Sure. We're actually doing quite a few things, as most healthcare organizations are seeing. They're constantly getting phishing attacks, whether they're targeted towards vice presidents, HR, finance, or in general just trying to grab people's credentials. So you have the spear phishing and the regular phishing campaigns. So we do the same thing to our own caregivers, and at times we think we might attack them more than the outsiders, but it actually helps with awareness. So we work with them on that. We do phishing campaigns throughout the organization, and then we also provide a daily threat intelligence briefs. So these briefs actually walk through a spear phishing attack. They also, with our incident response, they give an actual indication of this is what a phishing email looks like. This is what we do with it. We give them phone numbers and emails and a spam phishing button, stuff like that. So that is one area. One of the other areas is really MFA. You got to protect the identity coming from the outside and in. So if we can stick it behind like a Citrix storefront with MFA in front of there, or it's naturally able to go with an MFA in front of it, then it's good to be on the external facing end. The ones that we really worry about are those legacy applications that still require that single authentication that can't have MFA in front of it. And those are the ones where we increase the monitoring, get those logs up to the SIM. And that's where also we take the SailPoint logs and we put it in with our EDR, our firewalls, and we kind of correlate all that data to find anytime an identity is elevated in privilege. And we want an alert to fire off on that. So COVID kind of changed a lot of things for us, as we were primarily focused on our data centers, and most of our caregivers were internal. And very few really worked in the field out there remote. So we did have roadmap items for EDR and proxy service, but that kind of forced our hand to do it a lot quicker. So we deployed out EDR to every endpoint and moved everybody to proxy in the cloud for any device that would be mobile. So now when a user is sitting at Starbucks, sitting in Mexico or wherever they're at, when they boot up into their workstation, that's a protected workstation, and it boots in up to where they can authenticate with MFA, and then they go directly into a proxy to where they are protected, and they're already on the network as soon as they boot up. So those are the key areas to where really we've moved to protect the identities for all of our caregivers, and the fact that if that caregiver needs to move a desktop or a workstation to another facility as facilities close down, or they need to migrate more staff to a new location to help out with COVID response, that allows that just to travel with them, and they have still the same protections in place. So those are really the key elements that we kind of concentrated on this year for COVID.
Got it. Matt, did you want to add anything to that particular area?
Yeah, I look, both Kimberly and Mike made a couple great points there. And if you think about it through the lens of an identity governance strategy, there's two probably bullets there that to highlight. You talk about COVID and the impact that had, and Kimberly talked about one of the areas they want to improve upon is that bulk upload, right? These kinds of processes can be fairly tasking on an IT or IS organization. One of the big business value outcomes is not only time to patient care, how can I rapidly enable physicians and nurses with the access they need to treat patients? How can I do that in the most effective way? A strong and successful identity governance program enables organizations, hospitals in this case, health systems, to really take advantage of those efficiencies and repurpose those IS and IT assets maybe to go focus on other areas where they need to focus on to support the security charter of the organization. Mike was talking about these different endpoint tools and other areas of cybersecurity. One of the other things to consider is how can I integrate other security tools? Think of a DLP, for instance. How can I integrate a DLP and digest identity context from a DLP solution to drive workflow in my identity program? If I find data is on the move and that data contains PHI or PII, can I automatically invoke a lifecycle event that terminates or deprovisions or suspends access based on information that I'm gathering from these other endpoint tools? So as you think about your identity program, think about how can I connect my identity governance strategy to these other solutions?
Yeah, I think it's a good point. And I like holding back some of the cybersecurity, because once I get going on cybersecurity, I get excited and I'll go way off, and then I take over all conversations. But yeah, you're exactly right. Well, we implemented DLP across the board. We have it in our proxy. We have it in our email, where we're watching everything the identity or the caregiver does in the organization, and decrypting everything within privacy reasons. But it is a serious thing to look at when somebody gets an identity. That's an identity they have throughout their career at Providence, and our objective is to protect that identity as much as possible we can.
Absolutely, and I think given the threat vectors increasing with remote workforce, I think that's another area we have to closely monitor and make sure the right level of security protocols are in place as well. So again, moving along the theme, I know Kimberly mentioned that earlier in the comment that you made around automation, right? So because that is front and center right now. Part of the reason is operational efficiency, but the other driver for that is cost reduction, because COVID has really created an environment for providers to kind of figure out where can they really make sure they're being efficient from a cost perspective as well. So do you want to quickly touch upon how automation has been leveraged to kind of from an identity attribute / characteristics perspective?
Sure, you bet. So there's multiple reasons for it, but the reason that we distinctly went for the SOCH and date of birth for everybody is so that we can easily identify, and it's programmatic, that the same doctor that's working at one of our community technology partners is the same doctor working at one of our facilities, is so that we can have one access for that person. And we call it one access per beating heart. And that enables us to, not only from a security perspective, really distinctly know that if somebody needs to lose their access, we can in total we can terminate them across the board. Additionally, though, from a license perspective, you also can really assure that you only have one O365 license or one, fill in the blank license. So you're able to do some cost recovery there too. Additionally, you can make sure that the access they have, you can automate it based on their attributes. And so therefore the right access is being given. And we have, as everybody does, a history of people that have been here a long time have been collecting access. And by having an attribute-based automation, you're able to also trigger like certification events and things like that to ask if this person still needs their legacy access or not. So by leveraging the attributes, it's enabling us to do a better job, be more accurate on what somebody has access to. Is it the right access? Is it a duplicate license? All those types of things come into play. So it's a good thing all the way around. It also enables us to I think of the attributes by application as being kind of like Lego pieces. And so you have a new hire, they're in a job, they're in a department, they're in a location. Well, that might entitle them to 20 things. And that we then, as part of Birthright Day One for productivity, they get all 20 things. It also, as we continue down this path, reduces the number of requests that need to be submitted by the managers, which also improves their productivity and enables that new hire when they go in to claim their account to really be effective on day one.
Absolutely. And I think I agree, because automation and the whole governance piece is driving, it used to be compliance driven, but now it's shifting to be more risk driven. How do you effectively manage risk, just not have a checkbox from a compliance standpoint? Great. So Mike, any perspectives around the automation from your end?
Yeah, as Kimberly said, they're working in automation. We're also automating a lot of features as well. We've automated our incident response for phishing and malware, so that it really takes a lot of time for an analyst to kind of like look at the email, look at the different things that attributes that are coming in, and put them all on 2-3 monitors to take a look and see what's going on. Well, that's like a 15-minute to half-hour conversation that they're having with that screen. We've dropped that down to where it's 6 minutes, and we're continuously trying to improve upon that automation and make it quicker to where really everything's presented at once. We can to make that real quick decision. Okay, let's pull this from everywhere, or let's block this user based on how they're doing. The flip side of that is a partnership that Kimberly and I have, is when she creates something automated and it's external facing, like account claiming or password reset. If you need to do anything like this in the external facing environment, that's where my pen test team comes in, and we attack it. And over this last year, we did found a flaw. And it was really it was an odd flaw. After 10,000 combinations of a brute force attack, we discovered that we could figure out what was the true identity. So we've made some great progress in attacking ourselves, but also learning on how to differentiate the configuration. Maybe only allow people to try 1 or 2 times. If they don't get their account claimed within 2 tries in the same day, they're not going to get it. But it's things like that. It has to be that partnership between IS, governance, and the vendors as well, to understand that anything you put in place, we need to attack it the same way that an external or nation state attacker is going to attack us.
Yeah, and I think, Mike, you bring up a great point, right? Which is basically, this is not an audit, it's a collaboration between different entities to kind of make sure you're providing a product and a solution at the end of the day that is secure and works, right? So I think that's something that is very important as we're going through this, to think about it in that sense. So Matt, any inputs from your end as it relates to automation?
Yeah, and just to touch one thing, what Kimberly, Mike, and yourself actually were just talking about, if you look at historically identity programs over the last 20 years, the number one reason if they failed, why they failed, it was because they lacked collaboration. They lacked stakeholders participating in the planning and defining of the goals and objectives. So think about security and IT working together, the identity team, your clinical provider, your service desk systems, your AD administrators. All these people need to be part of the program and be stake owners in that program to truly have success. Rajesh, when we think about automation, we believe there's additional opportunity to create more efficiency. Kimberly was talking about that whole kind of role modeling, right? We feel that, along with, what we hear all the time from CIOs and CISOs is, hey, our nurses and doctors are really great at treating patients. They're not always the best at getting to their approvals or their certifications, and those can take time, right? So as an organization, we see opportunity to inject and infuse AI and machine learning into different business processes around identity to create additional automation. If you think about a role modeling project in an organization that's as dynamic as Providence, populations are changing, they're going through M&A activity, they're onboarding new applications. It's like painting a bridge. As soon as you define a role model, by the time you're done, you probably need to start over again and kind of reevaluate if that role model is still appropriate. We believe there's ways to make that role modeling process exceptionally dynamic by leveraging and injecting machine learning into that process, where we're always watching what's being approved, watching what's being denied, watching what new applications are being onboarded, how the populations of users are changing, and dynamically proposing new role models that create additional efficiency. We're also watching patterns of certifications. What's being approved, what's being rejected, what's not being recertified. If I'm recertifying a population of people or an individual, nothing's changed about that person in the last 12 months. Why task the manager with that? Why not just automatically recertify? Maybe there's opportunities to kind of leverage those type of efficiencies. So we are looking and investing and have invested, injecting what we call predictive analytics into our technology. And we really think it's a future of where identity programs will go.
Yeah, thanks for that, Matt. And that actually brings about a good conversation I once had not too long ago with a doctor, because he said, hey, you know what? He asked me what my background is, and I told him I'm from a cybersecurity background. He was like, hey, I've heard this thing too many times now that doctors or frontline workers don't like security. Less is more for them, right? But that's not the truth. And he was trying to clarify that, hey, you know what? We understand why security needs to be there, but we are in the business of saving lives. So for us, anything that slows us down is looked at as something we would not appreciate. That's the only, our point of view is from that standpoint. It's not about whether we want to be less or more secure. If we can provide us a solution that will make our lives easier, where we don't have to go through 10 hoops to make it work, we are all for it, right? So he was like, that's why he's like, I'm on a mission to make sure people understand we are not against security, we are for security, but we are for seamless security. And I think that resonates well when you actually have these conversations. To your point, and what Kimberly and Mike were also saying, automation enables some of that, wherein a person doesn't have to go in, request access, wait for 5-6 days for that access to be provisioned before they can do anything. It just makes no sense, right? So there is productivity, while in the provider side, it's a situation of life and death. So it matters a lot more. And those are great perspectives for us to look at as we're going through this.
You know, Rajesh,
So,
that's a super, I was just going to interject, that's a super good point. And in our collaboration conversation, you know, we can't forget the end user. I mean, we call them caregivers at Providence. And in every solution that we put together, we take great care to understand the impact to the caregivers and try very hard. The solutions Mike was talking about were implemented where, you know, when I boot up my computer anywhere, it just works. And that's how we have to think about our solutions for the end user. Is it going to be it just works solution, or is it going to be complicated and terrible and, you know, drive escalations?
Absolutely. Yep. Great point, Kimberly. And along the same theme, right? Maybe one of the things I can ask Kimberly, you can get started, but Mike, if you have perspectives, and Matt, if you have, please feel free to chime in, is let's say without a pure identity solution, because I've heard you talk about how identity solutions help you kind of address the needs and be more proactive post-COVID. But in the absence of that, I'm just curious to hear how did it have been, and how having a solution has helped you kind of effectively address the situation on hand after COVID?
Well, the simple answer is, if we didn't have a solution in place that we do today, we would have needed to hire a lot of people, which wouldn't have had training and wouldn't know what they're doing. So would have had a lot of risk, and we would have done a whole lot of overtime to get all these people onboarded. And it wouldn't have been fast, and it probably wouldn't have been accurate. And it would have been pretty darn ugly. The more scary part is that at the end of COVID, when you start trying to get people redeployed back to their original roles, or to terminate them, you know, really being able to ensure that everything they had access to was tracked and then terminated. And I don't think that would have been very successful.
Got it. Mike, any perspectives around that?
So what I have found, and really not too much security related. It's really because we collect the logs from the actual endpoint, the firewalls, the SailPoint, MFAs, all of our solutions. We're actually able to troubleshoot faster to help the user. So if they're having problems logging in or claiming their identity, we go to the logs. I mean, we're ingesting close to 2 terabytes a day into our analytics, and it's really helping us get to resolution faster. So on one end, it's great for the visibility, for security, to understand what the user does step by step when they're doing their daily job, but it also helps with troubleshooting what's the latency on that daily job.
Yeah, makes sense. Matt, any thoughts around this?
Yeah, so look, I love the stories that Kimberly shared, and we did another previous webinar with folks out in Methodist in Tennessee, where they shared, hey, we onboarded thousands of users in just a couple of weeks because we had automation in place. What I'm seeing with those prospective customers that we're now collaborating with to help them solve some challenges is that, the common theme I hear is, hey, we spent the last 20 years building up a security strategy, and in less than 3 months, we broke all the glass. We had to, because we had an influx of patients and we had to treat them. We didn't have time to think about what role was this doctor going to be, or what nurse was this nurse going to be. We just had to give them access, right? So now it's, and Kimberly touched on this, how do you now go back and undo all that? How do you get visibility rapidly of to what we gave access to who? Is that access even appropriate? And how do we backstep to a point in time where they now have access that's relevant to their role in the organization and it's appropriate? They're not over entitled or over privileged. So a lot of our newer customers are starting through the lens of, hey, I gave broad access, I got to step back now. I've got people have access to sensitive data, to clinical applications. So we're starting through the lens of compliance and recertification to first bring them back in line with their ultimate security strategy, and then build automation around those clean entitlements or clean permissions. So that's what we're seeing today is kind of undoing that knot that was created over the last nine months, but it was done to treat patients, right? Which was ultimately most important.
And I do have a question before we go there. Any perspectives from either of you? Maybe Kimberly, we can start with you again on from patient side, right? Which is basically enabling the patient side of identities as we're going through, because a lot of focus is now on the employee side. So any perspectives around that you want to throw as to what you're seeing in the market right now?
Yeah, so there's what I am seeing, and we have a separate team that focuses on our patient customer base that's working on better portals for being able to access their medical data. It's interesting too, in the marketplace, I'm seeing a lot more companies out there that are trying to provide a better experience for the patients, where they can bring together their Providence records, their University of Washington records, all their records into one place, and to have a richer experience. So I think that this is a growing area. I think that there's, at some point at Providence, we'll end up crossing that line where we'll want to bring in our patient and employee information together. And how that's going to look, what that's going to look like is undetermined at this point. Because part of it is wondering, what really is the value of that? What does that benefit? What would be the business value to do that? But it is a pretty high complaint from our patients that, the portals are really not as rich as they need to be, or as functional as they need to be. And frequently what we hear is, hey, my bank can do something better than what you guys are doing. And it's like, we're all online shoppers, and yep, I wouldn't disagree. As a patient, I don't disagree.
No, I agree, right? Because I think everybody's used to the experiences through Amazons and the banks that kind of figure out what that experience looks like, and they want a consistent experience, similar experiences across a multitude of their journeys. So, and I think healthcare being one of them, they're like, hey, when I go in, why doesn't it tell me what happened last time? What are the options? All of that available for me to make that decision, informed decision, before I even come into the hospital, right, for my regular checkup, or in some cases, give them more data points that they can use for their own consumption as well. And the other thing I'm also seeing is how, from a provider standpoint, how we transition off to letting the users own their own identities. So how do you make that happen as part of this whole evolution? So those are things that, as you said, Kimberly, are evolving. More to come on that, but definitely areas to think about. So Mike, any perspectives around that from your standpoint?
So we have a couple teams at Providence that are really focused on the patient and their experience and their identity coming to check, like either MyChart or their mobile application. So we got the digital innovation group who does amazing work in this area, and we have the healthcare intelligence team that also does the same thing. So these are outside of IS specifically with DIG, but with healthcare intelligence, they're new ingestion into IS. That goes further back to the collaboration, is working with their teams on how they're building these. So they're making a great user experience for telehealth altogether. And that's that new identity coming in. How do they do the identity for the user when it comes to the mobile application? How do they do it to the web-facing applications? And that's where we work with them and say, okay, well, let's walk through the code. Let's walk through how the data moves. And then let's put the security controls in place that help protect this from attack, but also help protect that user's identity in the meantime when they are logging into this. We don't want man-in-the-middle attacks. We want a secure connection whenever they're checking their data. We want to make sure they're protected and they feel safe as a patient coming to Providence for their care, whether it be virtual all the time or it needs to be at a facility, at a kiosk per se. That's a new element that is in security. It's always been just put it up there, patch it, we're good to go. No, you got to take a bigger advantage of this now, is because you can do so much more, literally standing in front of a kiosk than typically you could before. So it's a challenge, but the collaboration goes back to understanding what the patient needs from the organization and protecting that identity when they do need it.
And I just want to jump in on and say that from just really good points, Mike, the telehealth, I mean, COVID really, we had a lot of, the digital innovation group had a lot of projects and ideas in play that got really accelerated for COVID. And telehealth is a great example. How work that was being was in play, was in the strategy, was designed, was ready to go, but there wasn't the appetite for it. And with COVID, telehealth is a great example, just exploded, and very successfully too, which was great.
Yeah, there's a tight correlation with identity out there, right? Because I think with your patients, how do you make sure you're correlating those two? Matt, any perspectives?
Yeah, look, this is as real as just this morning. We spent an hour and a half on the phone with a large health system trying to solve this very problem. They have, in this case, 16 different patient-facing experiences across pharmacy, surgery center, rehab, right? And each of those experiences requires something different to create a new patient account and ask for additional services for that health system, right? So they're thinking, hey, I've already got this kind of SailPoint infrastructure. How do I leverage the plumbing to provide a single experience to create my patient account, get the initial, and just like we have roles for employees and business relationships, they have a variety of different roles for their patient populations. So they know those patients are going to require initial set of access, but then how do we enable them with an intuitive way to request additional services that that health system offers? So we're seeing this rapidly become a front and center conversation with not only our current customer base, but prospective customers, that they want to leverage the same strategy to manage identities. Again, back to the very front part of the conversation. It doesn't matter what kind of human identity they are. They want a single, consistent experience to manage those. And by the way, watch activity, right? Who's leveraging the wellness program, who's leveraging the rehab program, and they can actually drive marketing initiatives to have a better, tighter relationship with their patient populations.
Great, thanks for that, Matt. So maybe let me just pull up the question, and Mike, if you don't mind, I'll start with you on that. So this is from Paul. Paul runs a startup which was funded during the COVID pandemic. And of course, just like a lot of companies, they didn't see a need to have a physical office. It's a 10-employee shop. So the question that Paul has is, what advice would you give on securing an IT infrastructure without a ton of overkill to meet the needs of secure software product company, right?
Actually, can you repeat that real quick?
Yeah, sure. So basically, it's like, how do you make sure that because the workforce is remote, they're not on site with the physical office anymore, so there are no perimeters as such. It's like, how do you make sure you have a secure IT infrastructure? I know this is more on the infrastructure side, not so much on the cybersecurity side, but without a ton of overkill to meet the needs of a secure software product company.
Okay. So ours, I think some of the approaches we did, because we're securing the endpoint, securing the path to what is needed, it relaxed a little bit of some of the controls we needed on the identity itself. Because you're going to have to, you need, as a software company, like a startup, you got to get access to stuff like GitHub and open source software, and you're trying different things. Like if you're in the cloud, you're spinning things up, spinning them down. You're opening things up, web interface. You need to test them, and you get the risks and the gaps are there, and the possible compromises are coming as soon as you open stuff up. So we took the approach of protect the endpoint, protect the path that the user uses, and then what we do is we just take all that identity data from our vendors, with SailPoint and how it's integrated in our system, and we just watch what's going on. So if say I'm a basic user at Providence, I have no privileges whatsoever, but tomorrow I decide, I need to load something on my laptop, so I want somebody to elevate my privilege. Well, there's an alert that goes off, so I know what changes in that environment. So it allows our developers to go out and do their job without really strong arming them security-wise, because we're not going to make any progress if we just put controls in place and say, no, thou shalt not. If you take that approach, you'll never get anywhere. There has to be the partnership with the developers, with the users, and actually having that conversation of, tell me about your job. What do you need to do? And put some guardrails in place. Guardrails are meant to kind of bend a little bit. So it's really just working with them on what they need to do for the job, and then watching, monitoring. And if they go off and bump a rail, just have that conversation. Hey, this is why we have this guardrail in place, because we have a risk out there. Because as soon as you open, Azure, it drives me insane. As soon as you build an instance, it creates an RDP to the outside. And it's like, it just freaks me out all the time. It's like, okay, no, shut it down, shut it down, shut it down. So as soon as somebody spins something up in Azure and that RDP pops up, we got to automate that, crash it. Get rid of that RDP so that we don't, because we've noticed within 2 minutes that gets attacked. So it's things like that is how we work with them to make sure we don't stifle them, but also provide the security that's needed. I hope that answers the question.
No, I think I'm sure it does. Also, just to add to that, right, I'm seeing a lot of DevSecOps, right? Now people are saying, hey, how do you embed security as a built-in model rather than a bolt-on, which is an afterthought? So they're looking heavily on that. And especially if you're looking for a secure software product company, I think that's one of the key aspects as you're going through that, because we were just having a discussion yesterday from a product standpoint, security is no longer a nice to have, it is a differentiation in the market. because the easier you make for a company to go in and say, hey, your products are already secure, they're certified from, say, HIPAA perspective, SOX perspective, or whatever other certifications you want to put in there, it just makes it easier as a company to go and be a vendor for a provider like Providence or Kaiser or any other provider, right? So just want to add that.
Yeah.
But before I close that, Matt, Kimberly, anything else to add to what Mike just mentioned?
Yeah, I would, and look, for me, it doesn't matter if you're a one-person organization or a million-person organization. If you have the same type of critical applications and you have the same problem where you have static data sitting out on a file share or in a cloud storage container, the business problems are the same. The time it takes to stand up a program, manage the program, and build the automation, it might be a little bit less with a very small organization, but the fact is the energy to create the life cycles and the governance controls around the applications and the data is exactly the same. It has nothing to do with the number of identities or people in the organization. It's more about the workflows and the endpoints. So cataloging those endpoints, the critical applications, where do I have data? How do I store that data? And how do I protect access to that data? Having the catalog of those endpoints, and then determining, who truly needs access to those endpoints and how do I control that access and govern that access. That for me is really the foundational element of any identity program. What you don't want is, hey, we just hired a new employee. Let's just make them like Billy down the hallway or Sue down the hallway, and we'll just keep replicating that effort. That creates a disaster, right? Because now it takes one person to have inappropriate access that you keep replicating, and that problem factorially gets worse and worse and worse. So cataloging the endpoints and defining who really needs to do the job is probably the best place to start.
And the only thing that I would, the only thing I would add is that, and Mike, maybe you can speak to this a little bit too, is that, one of the, with everybody working remotely, people's wireless network configurations and home networks, I think there can be some benefit for organizations letting, like in this case, the question was 10 employees, everybody know what best practices are and really try to teach and coach people to ensure that their home networks are secure.
Yeah, home networks. Yeah. I can spend a whole day about home networks, but yeah, it's security awareness training should go for everybody. And one of the things, and sorry for this tangent, but one of the most valuable things I've ever seen as part of the security awareness program was when we started talking about home networks and monitoring your kids on social media. That's when people's ears perked up. The nurses and the doctors, they were more interested in how do I protect myself and my kids, at home than they were about, oh yeah, I need to change my password every 90 days. Ugh. But yeah, it's one of the things. Spread the security awareness because the problem is there are so many passwords and logins that people have to maintain now, from your banking, your social media, your HOA, work, that people will start just reusing the same thing, or not start. They've just been doing it. We have found it on the dark web. Thousands of Providence accounts have been compromised from Target and, you name it. It's out there. We find them, and then we go through and we just reset everybody that we find. And we look on the dark web like weekly. But it's one of the things. Just talk to them about your home network. How's your home network set up? Or things set. You really can't set a requirement, but set recommendations. You should have a home router. Point them to somewhere they can set up their home firewall or their endpoint firewall on their own Windows device or their Mac device. Stuff like that helps out the end user at home.
Absolutely. Yep. Makes sense. I know we're at the end of our core set of topics we wanted to discuss, but before I close it, maybe back to you, Mike, any parting thoughts? I don't see any active questions. Oh, actually, I do see one more. Maybe we can take that. As Kimberly, maybe if you want to address this, how important in your work is PHI in medical images and medical documents?
Oh, we consider them as PHI for sure. There's definitely, it is important. And I'm not exactly sure if the question is, how are we protecting them? It's a great question.
I think the question is around, how do you protect them?
How do we protect them? So Mike, you might have more information here. I know that they are protected. They are in, I know we've been doing some moving around of what's in what zones.
So there's quite a bit. So I also
Yeah.
run data protection right now. So we started classifying our data through labeling. So we're using Microsoft AIP, and we've had the DLP in place when it comes to email, the network, and at one point in time we had endpoint as well. So as we move everything into Azure, or majority of our compute into Azure, we're really getting to focus on AIP and labeling our data. What's confidential, what's PHI, what's PCI, if it's actually there, what's DoD. So we put those in place. We decrypt everything that either goes across an endpoint that a user is at, a server, any site-to-site connections that are made, any VPNs. So we inspect as much as possible to see where PHI is moving. We also segment our networks into multiple different zones that help isolate what is a PHI area to where we focus a lot of our attention to. We tighten those controls around that segment compared to just a workstation segment where we don't really want PHI going to the workstation. So those are a lot of areas where we kind of look at those. And then going back to what Matt was saying about critical assets, that's when you set up your alerts for your critical servers and assets, like an Epic or a Kronos, Lawson type of stuff when it comes to not just PHI but PII. You set the alerts when you see amounts of data traveling in a direction that is not normal. This goes back to log analytics and setting up the user behavior or the AI behind the scenes of understanding that every day of the week, Kimberly gets on and she moves this file to here or this file to here. But today she started moving 10 gigs of file from this server to this server, and that's uncommon. And we get a flag on that, and kind of have that conversation. Kimberly, saw some odd behavior today. What you been doing? So it's stuff like that we try to protect. We're not perfect at any of this. And literally we've been starting a lot of this over this last 6-9 months as COVID happened. It just changed the entire thought pattern and everything we've been doing. So yeah, we're still in our infancy and figuring this out and trying to get there. But it's a start. It's a start.
And I've also seen, right, the concept of break the glass. So we're trying to access certain records. You just make sure you get the right level of notification up front saying, hey, this is protected information, especially when there is valid reasons. They want to make sure they actually have some notification and logging associated with that. We see a lot of that as well to kind of make sure your PHI data is protected. And I'll see there was a quick follow-up question on that. Maybe Mike, if you want to take that as well, is what do you do when you need to share that information?
Okay. So there's different methods of sharing that we actually do. We do have an authorized SATP solution in place. We typically block all cloud storage unless it's the one we have a contract with. But there is exceptions in place when we're working with like HIE partners, or HIM actually needs to work with and just to give a patient their medical data that they need on a CD or a thumb drive, and we encrypt it and send it over through that method. But we do everything by exception. So we deny everything at first, which kind of makes security the bad guys. but and we require people to put an exception in, and it's really, if it's a one-off, we do a small exception on what needs to happen, what can be granted and allowed. If it's a new business process, then we just really walk through what they're doing and make sure there's controls in place and we're protecting the data if it needs to be shared and who it's being shared with. That's really getting more important nowadays with, the zero login domain, vulnerabilities that are going off. Now that changes how you share stuff because it's no longer a two-way conversation across domains. Now it's like, okay, well, we're going to break that because we can't trust you. So do we just provide a one-way conversation, or now do we have to change that and say, okay, do we have a shared cloud environment where we can drop data in there and we can actually track who's using it or who's viewing it? Or do we send it over SFTP? And for God's sakes, don't send anything over email because that's just not a good file transfer system. But those are the areas to how we transfer it over and try to protect it in transit.
Yeah, and Rajesh, just maybe to kind of come back to the beginning theme where we talked about the DNA of an identity, right? We strongly believe that if you have an identity governance program that only addresses provisioning and governing access to applications, you're only solving half the problem. This data problem, especially in healthcare, if you think about clinical data being extracted from EMR systems to look at care, to track care outcomes, to look at care plans, share data with my primary care physician, to send data to my rehab facility, it's a significant problem. And this is why for us, I don't want this to be a sales thing. It's not, it's about strategy. The fact is, this is exactly why we implemented the ability to govern applications and data through a single lens. You've got to know who has access to what, and that what includes applications. And do I have access to a file share? Do I have access to a cloud or box storage? And oh, by the way, that access I have, what's in it? Is it PCI, PII, PHI? So having your identity governance platform in place that has the ability to provision that access, govern the access, but also scan that data and classify that data, we believe is exceptionally important. A lot of prospective customers will say, well, I use AD groups. Well, if you think about the AD nesting problem associated with permissions, this is not a great and sound way to manage access to file shares or data. Part of our capabilities, we can kind of unnest the permissions that are associated with AD groups, and you'll find out that Carol got access via this file because of another nested permission, right? So how do you normalize those types of permissions and build them into the life cycle events of your identity governance strategy? So when you're starting your program, step back and don't just think about, I want to automate access to applications, but how am I also going to manage access to the data, govern that data, and classify that data?
Makes sense. Thanks for that, Matt. I know we're almost at the top of the hour, but I want to at least take this opportunity, starting with you, Kimberly. Any parting thoughts for the broader audience before we call it a call?
Well, the only comment that I'll make is that very often organizations see implementing an identity program as a project, and it isn't. It's a program. It's a lifestyle. It's never ending. For us, it started with human accounts, but we need to move on to non-human accounts and really look at everything as an identity. Is not just a person, but it's pretty much everything, and it's never ending.
Wisdom. Yeah, absolutely. Mike, any thoughts from your end?
My key one is look at everything you're doing identity-wise as whether you would want to be the customer. So when I think of security, when either dealing external to my chart or to internal, do I really want to be a customer of Providence if I don't trust their security? That's the way I look at it.
Absolutely. Great point. Matt?
Yeah, so did someone already say this is a program, not a project, and it's a lifestyle? Because I agree with it. and by the way, you've seen the collaboration between Kimberly and Mike. I mean, these are key roles in two different parts of the organization, but they collaborate exceptionally well, which is what it takes to make these things successful. The only thing I would add is with all the cloud transformation that's going on right now, there is a third pillar to this topic, right? We talked about applications, we talked about data, but cloud infrastructure is another. If you're setting up your own Azure environment or Google Cloud environment, or you name your cloud infrastructure, how are you governing the access and the permissions within that cloud infrastructure? There's some DevOps team out there that's developing, enabling, and deploying and configuring applications and services in that cloud infrastructure. And that truly is a third pillar to this problem. So if you're on a rapid cloud infrastructure strategy, think about that as well, and how does that play into my overall identity governance strategy?
Absolutely. Thanks for all the great words, and hopefully the audience found this useful. Again, I think a recording of this will be shared later for you guys to review it, share it with whoever you think might benefit from it. And we definitely had a good time talking through the key topics that are very relevant to the industry right now. And you guys have a good time looking to the cook show after this, which unfortunately I would not be able to attend. Hopefully I'll get to see it later. Thanks everyone for your time. Thanks Kimberly, Mike, and Matt.
Thank you, Rajesh.
Thank you.
Thank you.
Continue the conversation, please join us on Twitter. And now, please welcome Master Chef Matthew Migliori.
Hello, everyone. Hope everybody's well. Hope everybody had a great holiday weekend. I know I did. So today, what we're going to be making, just a quick little demonstration. So I have some bread pudding for you guys, some bread pudding with almonds and toffee. Bread pudding is like, it's so easy to make. It's really simple. You can take your leftover bread, anything that you have like dry, or if it's stale, something like that. And basically you soak it in like an egg mixture with cream and sugar and dried fruit and any kind of nuts that you want. You let it soak overnight, and then you lay it out on a tray, and then you bake it at like 350. And then we pour some caramel sauce over it and just give it a nice crust. So first thing I'm gonna do, I'm just gonna show you guys the quick soak. Okay, as you can see, I have my finished bread pudding here. And again, bread pudding takes about a day to soak and about like 30 to 45 minutes to completely cook, okay? So first thing we're gonna go ahead and do, okay, we're gonna add in our eggs and our dairy first, okay? Most important, because we wanna create like a nice little slush for our sugars. Okay, so I'm gonna add in some of my cream. And again, I'm just showing just a little, just like a little bit of the bread pudding so you get an idea of what the base looks like, okay? So we're gonna whisk together our egg and our cream. Okay, we're gonna add in a little bit of our brown sugar. A little bit of granulated sugar. Okay, and then a pinch of salt. And I always love combining salt with anything that's sweet, okay? It's a really good balance of savory to sweet. Okay, let's give this a quick mix. Okay, we're gonna give the sugars a little second to dissolve here. Okay, next thing we're gonna do, we're gonna add in our dried fruit. Okay, you can use raisins, golden raisins, dates, prunes, apricots, anything that you prefer. If you're using like something that's a little bit bigger than a raisin, we can just go ahead and chop those. Okay. So it doesn't have to be super fine. Okay, we can just make them nice and coarse, about the size of a raisin. Okay, and then we're gonna go right in with our dates. Okay, and just mix these around. Okay, and then what I like to do, if you can notice from my example bread pudding here, I mix almonds inside and I also top them with an almond crumble. So basically what the almond crumble is, it's peeled and sliced almonds mixed with some maple syrup and some sugar. And then you just mix that up until the sugar starts to melt. And then you just top the bread pudding with it and then cook it at like 400 degrees after the 350 for like 10 minutes. Okay, so I'm gonna go ahead, place some almonds into my soak. Beautiful. And again, the bread that you want to use, you don't want to use fresh bread for this. Okay, this has been, I've let this bread sit out for like a couple of days. Okay, so it's very stale. It's like almost like close to like rock hard. Okay, and that's exactly what you want, because you want all the moisture out of the bread so it can take in all the moisture from our soak. Okay, so we're gonna go right in with our bread. Okay, and again, we're just gonna mix this up, and we want like a nice pool. Okay, if you guys noticed the recipe that was sent out, I mean, try this at home. The recipe that I sent you is really good, like for like a 9-inch by like 12-inch pan with like 2-inch sides. Just spray it down with nonstick spray, line it with parchment paper, and then just load it up. Okay, but again, see how it's starting to pool at the bottom there? Okay, that's good. Okay, we just want to press it down lightly. And again, we would wrap this in plastic and then place it in our refrigerator overnight. Okay, we really want that bread to soak in everything. Okay, and once you mix it the day after, it's going to start to break apart, but that's totally fine. Okay, that's what we want. Okay, so we have our soak off to the side. And again, with the recipe that was sent out, it's really good for like a 9-inch by like 12-inch pan or a 13-inch pan. You can do glass, you can do metal if you want. Glass takes a little bit longer. I would say do about 350 when it's covered for like 45 minutes. For a metal pan, I would do about 30 minutes at 350. Okay. And then what we're going to do after we made our toffee sauce, right? So toffee sauce is basically a caramel sauce. Okay. So we take like about a cup of sugar, a couple tablespoons of water just to create a slush. Okay. Because if we were to turn on the heat with just sugar in the pot only, it would burn, right? And like the top wouldn't cook, but the bottom would burn. So the water acts as like a catalyst, so it can really maintain that heat and start caramelizing evenly. So once it gets down to a deep amber color, what we do is we shut off the heat and then we add in butter. Now, the difference between a toffee sauce and a caramel sauce is the fact that we're browning some butter into that caramel. So the first thing we add to it in 3 separate increments is our cold butter. Okay, so we add in the cold butter, whisk it, and it's gonna start expanding. Okay, because you're putting something extremely cold into something that's about 325 degrees. Okay, so it starts expanding a little bit, right? And then once you're finished with the butter, that's when you mount in with your cold cream, and then it shouldn't seize up and it should become nice and creamy, just like this. Okay. So again, what we do after we take our bread pudding out, okay, it's been covered at 350 for about 30 to 45 minutes. What we're going to do is we're going to remove that lid, and we have our almond crumble on top. What we do is just drizzle it with a little bit of that toffee, okay, and then we place it back into our oven for about 15 minutes at about 400 degrees. And what that does, it caramelizes the top because there's so much sugar in this, right? We have sugar and maple syrup with the almonds, and we have sugar and butter and cream in the toffee sauce. Okay, that's all going to caramelize the top of the almonds and make a really, really nice crust. Now, there's a couple ways that you can eat this. You can eat it straight out of the oven, or if you're like going to like a holiday party or something like that, and you're bringing it, you do it the night before. That's great. Just heat it up in your oven, or what you can do is you can even pick it up in a pan with some butter and just sear, get a nice crust on both sides, and then just hit it with the top of that toffee sauce. Okay, so I just have one little example for you guys here. Okay, so again, really great, and like this holds because it's a lot of sugar and it's cooked dairy, right? So it can hold for like 2 weeks in your refrigerator. You can even cut these in individual portions and freeze them, whatever you guys prefer. Okay. And then we're just going to drizzle it with more toffee. And you can get really crazy with the plating too, you know. It's all subjective. Okay. And what else goes really, really good with this? What you guys can do if you want to go to the grocery store, pick up like a little tub of creme fraiche, or whip up some whipped cream. That also goes really, really well with the almond toffee bread pudding. So again, guys, once you make that caramel sauce, let it get to a deep amber color. Okay, and then mount in your butter in 3 separate increments, and then just finish with the heavy cream, and it comes out nice and creamy and caramely, just like that, guys. And guys, thank you so much for joining me. Thank you for having me on again. This is a lot of fun. Hope to do it again. Hope to see you guys soon.
Thank you, Chef, and thank you to everyone for joining us today. Have a great rest of your week.